Men over 60, have you noticed that your erections are not as firm or dependable as they once were? Many men blame age or low testosterone, but healthy erections depend on circulation. When blood vessels become less flexible, the penis may not receive or hold enough blood during arousal. The news is that food choices can support vascular health. I am Dr. Leah, a urologist with 15 years of experience helping older men protect their health, confidence, and quality of life. Today, I will reveal 3 fruits that may support better blood flow and erectile function after 60. They are not miracle cures and cannot replace medical treatment, but they provide nutrients connected with nitric oxide production, blood vessel function, and heart health. Before we begin, please like this video, subscribe, and turn on notifications for more men's health guidance. Tell me in the comments which fruit you eat most often. Stay until the end because I will explain a mistake that can cancel many of the benefits these fruits may provide. The first fruit is watermelon. Its flesh contains an amino acid called L-citrulline. Inside the body, L-citrulline can become L-arginine, which helps produce nitric oxide. Nitric oxide signals blood vessels to relax and widen, allowing blood to move easily. Because erections depend on healthy blood flow, this pathway has attracted attention in erectile health research. However, watermelon should not be presented as a substitute for prescription medication. The amount of citrulline in one serving is lower than the concentrated doses used in supplement studies, and results vary. Think of watermelon as part of a circulation-friendly diet, not an instant treatment. A practical serving is 1 cup of diced watermelon. Eat it with breakfast, enjoy it after exercise, or combine it with plain yogurt and nuts. Avoid adding sugar or turning several cups into juice, because juice is easy to consume quickly and contains less filling fiber than whole fruit. Watermelon also provides water, potassium, lycopene, and vitamin C, making it refreshing in hot weather. If you have diabetes, kidney disease, or follow a fluid or potassium restriction, ask your healthcare professional what portion suits you. Consistency matters more than overeating. A moderate serving several times weekly can complement other habits. The second choice is berries, especially blueberries, strawberries, blackberries, and raspberries. These fruits contain flavonoids, including anthocyanins, that give berries their red, blue, or purple color. Flavonoids may support the inner lining of blood vessels, called the endothelium, and help maintain circulation. An observational study of men found that higher intake of flavonoid-rich foods was associated with a lower incidence of erectile dysfunction. This does not prove berries prevent or cure erection problems, but it supports including them within an eating pattern that protects cardiovascular health. Aim for ½ cup to 1 cup of fresh or frozen berries. Add them to oatmeal, yogurt, or a smoothie containing protein and no added sugar. Frozen berries are nutritious and affordable when fresh varieties are unavailable. Avoid syrups, sweetened dried berries, jams, and desserts marketed as fruit products because they may contain amounts of added sugar. The fiber in berries helps slow sugar absorption and supports weight, cholesterol, and blood glucose management. Those benefits matter because diabetes, obesity, and vascular disease contribute to erectile difficulties. If you take blood-thinning medication or manage diabetes, berries are suitable, but discuss dietary changes with your healthcare professional. Regular portions are more useful than occasional excess. The third group is citrus fruit, including oranges, mandarins, grapefruit, and lemons. Citrus provides vitamin C and flavonones such as hesperidin and naringenin. These compounds have been studied for potential effects on endothelial function, blood pressure, and circulation. Since erections depend on responsive blood vessels, supporting vascular health can support sexual function. Choose whole citrus more often than juice. 1 orange or 2 mandarins provides fiber that slows sugar absorption and helps you feel satisfied. Orange juice contains nutrients, but a glass delivers sugar quickly and makes it easy to consume several fruits at once. If you drink juice, keep the portion modest and avoid added sugar. Eat citrus with breakfast, add orange segments to salad, or squeeze lemon over fish, beans, and vegetables. Lemon water may encourage hydration, but it does not cure erectile dysfunction or remove plaque from arteries. Grapefruit requires caution because it can interact with medicines, including some cholesterol, blood pressure, heart rhythm, anxiety, and transplant medications. The interaction may raise or lower drug levels in ways. If you take medicine, ask your pharmacist before eating grapefruit or drinking its juice. Citrus supports a heart-healthy diet, but it works best alongside exercise, sleep, and medical care. Now that you know the three choices, you may wonder which fruit is best. There is no winner because each provides different nutrients. Watermelon offers citrulline and hydration. Berries supply anthocyanins and fiber, while citrus provides flavonones and vitamin C. Rotating them across the week gives you a range of compounds than eating one fruit repeatedly. A plan could be 1 cup of watermelon on 2 days, half a cup of berries on 3 days, and 1 orange or 2 mandarins on the remaining days. You do not need all 3 at a meal. Portion size matters, especially if you have diabetes, insulin resistance, or difficulty controlling weight. Pair fruit with protein or fat to make meals more satisfying. Examples include berries with yogurt, an orange with nuts, or watermelon alongside eggs at breakfast. This combination may reduce the temptation to snack on processed foods later. The mistake is turning fruit into a sugar-heavy drink. Juicing removes much of the fiber and allows you to consume several servings. Sweetened smoothies, canned fruit and syrup, and fruit-flavored beverages may work against your goals. Choose fruit, drink water, and keep added sugar low. Better circulation comes from your eating pattern, not one ingredient. Fruit can support vascular health, but it cannot overcome every habit that damages circulation. Smoking, inactivity, uncontrolled blood pressure, high blood sugar, poor sleep, excess alcohol, and stress can reduce erectile function. If these factors remain unchanged, adding watermelon or berries alone is unlikely to produce a difference. Aim for movement. Walking, cycling, swimming, and resistance training can improve cardiovascular fitness and help blood vessels respond effectively. Sleep matters because inadequate rest can affect testosterone, appetite, stress hormones, and sexual desire. Maintain a consistent sleep schedule and discuss snoring or daytime exhaustion with your doctor because sleep apnea may contribute to erection problems. Review your medication with a healthcare professional rather than stopping anything yourself. Some medicines can affect erections, but discontinuing them without guidance may be dangerous. Your clinician may adjust the dose, change the medication, or investigate another cause. Erectile dysfunction can be an early sign of cardiovascular disease because penile arteries are smaller than other arteries. Seek assessment when difficulties persist, appear suddenly, or worsen. Ask about blood pressure, cholesterol, diabetes screening, and other risk factors. Fruit belongs in a heart-healthy plan, but proper diagnosis, medical treatment, exercise, and healthier habits provide the strongest foundation for improvement. The 3 fruits after 60 are watermelon, berries, and citrus. Watermelon supplies citrulline for the nitric oxide pathway. Berries provide anthocyanins and fiber that support vascular health. Citrus fruits offer vitamin C and flavonones connected with blood vessel function. Together, they strengthen an eating pattern that supports circulation. Remember the words may support. None of these fruits is a guaranteed treatment for erectile dysfunction, and eating them will not reverse vascular disease overnight. Improvements in erectile health depend on several factors, including exercise, sleep, weight management, stress control, nutritious meals, and medical care. Begin with one change. Add berries to breakfast, enjoy a serving of watermelon, or replace a sugary dessert with an orange. Choose fruit more often than juice, avoid added sweeteners, and watch portion size if you manage diabetes or kidney disease. If erection difficulties continue, do not suffer silently or assume nothing can be done. Speak with a healthcare professional because treatments are available and assessment may reveal another health condition. If you found this video helpful, like it, share it, and subscribe with notifications turned on. I am Dr. Leah. Keep supporting your circulation, protect your health, and remember that changes remain possible at any age.